Welcome, beautiful and amazing people of Stuart, Florida, and those living in the Treasure Coast. My name is Dr. Hartwig. I am a doctor of physical therapy. I've been in practice in orthopedics for the last 12 years and recently opened a company called Atlas Health and Wellness. You can reach out to us at atlashealthandwellness.com. If you got questions regarding this video, questions can go to info@atlashealthandwellness.com. And our phone number is 954-932-8527. I'm getting better at that. Anyway, so without further ado, we're going to discuss running and common injuries associated with running. Now, Atlas Health and Wellness, what we do is we help empower people to prevent arthritis and not, what is this? Go away. And not just deal with it when it happens. You don't have to give up your running. What you need to do is to train to run for life. And if you don't know how to do that, well, come get your wellness evaluation today at Atlas Health and Wellness, and we can help empower you to shoulder the weight of your world, which in this case would be running, among other things. Anyway, I digress. Oh, just as a side note, shoes matter, okay? Minimalist shoes are garbage, okay, unless you are just, you have the right feet for it. Most of the time, they don't give enough arch support, so I will just say that minimalist shoes are not the best, especially for those of us that have high arches and other mechanical problems of the foot. So if you have, if you are a runner and you are just buying random shoes, you need to buy shoes appropriate to your foot type. So I would check out any running store. Most of these companies that are running stores, they are trained to evaluate how the foot moves in biomechanically, and they are trained by the people of ASICS. They're trained by the people that represent Brooks, because each shoe is a little different and it caters to each type of foot type. So if you don't know what kind of shoe you should be wearing, you should get with a running store and try to get that addressed. It's much cheaper than going with orthotics. Orthotics are good in certain circumstances, but in most circumstances, in terms of athletics, good shoes matter. Anyway. So I just pulled up this article on Running Magazine, and it goes over the most common injuries associated with running. All right. So ankle sprains is one of the first things they bring up. I don't think this is the most common in terms of injuries. Unless you're a trail runner, ankle sprains are more common with people running on uneven surfaces, less so when they're running on pavement and things like that. But they mention it, and let's see what they say. Well, less common for road runners. See, those of you who like to put miles on the trails, that can be an issue. So a major issue with ankle sprains is usually a tightness issue, which puts your anterior talofibular ligament at risk for spraining when you catch your foot. A lack of dorsiflexion is what I'm talking about. Anyway, also it can be from weakness, but most of the time it's just plantar flexion contractures that predispose you to this injury. Hamstring injuries. Let's see what they say. Your hamstrings play an important role in your running stride, but if they are too weak, too tight, or too tired, they'll be prone to injuries. I agree. And I would add to that a lot of the time, hamstring injuries masquerade as lumbar problems masquerade as hamstring injuries. So a lot of runners will experience hamstring pain, which is actually referred pain from their low back. So if you don't know what the difference is, well, schedule your free evaluation with Atlas Health and Wellness, and we can tell you whether your hamstrings are healthy or not. We use strength testing, dynamometry, and software that can help analyze your strength and use the research in physical therapy to, instead of a cookie cutter approach to physical therapy, we are individualizing things and basing it on what you individually need. Men and women are different. Age groups are different, and your occupation throughout your life influences how your body appears on physical examination. So if you're a runner and you want to stay a runner, schedule your evaluations today. I digress. IT band, bad run. Let's see, your iliotibial band runs from your hip to your knee. Yes, often mistaken for a muscle. That's not true. Yes, it is a band, but it's attached to the tensor fascia lata, which is a muscle. And they're going into some detail, but I'm telling you they're probably not as detailed as I am. I will say that the IT band is typically an issue if there is weakness in the gluteus medius and a hip flexion contracture. What happens is the iliotibial band is moved anteriorly to the in relationship to the greater trochanter and causes friction. That friction leads to bursitis and often an imbalance in the gluteus medius and tensor fascia lata is what IT band can predispose you to. And we would know that is the case based on our strength testing and your hip range of motion. Stress fractures. Again, this kind of goes back to the whole concept of wearing the right shoe wear. Often runners are overtraining, or they're not, they were a runner and they get right back into it, and shin splints do happen. Basically, you need to slowly work your way into things, make sure that your range of motion, your calf muscles are such that you're not impacting the tibia when you're making impact with the ground as hard. And that usually results in shin pain, shin splints, but also can lead to stress fractures if you're overdoing it. If you're running more than if you're like one of those super marathoners or Ironman, you really need to take into consideration to give yourself appropriate rest between runs. Plantar fasciitis. This is a big one, and it's also related to Achilles tears and Achilles tendonitis. Most often runners have very tight calves because of the nature of running. It's the push-off phase of the run where you're pushing your body weight forward. It causes the development of tight posterior compartment, which has lots of muscles in it that help us plantar flex. They get tight. They put stress on the calcaneus, and the calcaneus puts stress on the fascia underneath of the foot. So if you don't know what your ankle range of motion is, make your evaluation with Atlas Health and Wellness today. We will identify these problems and eliminate them before you run into actual pain and inflammation that could potentially put you out of the running game and lead to weight gain and all kinds of bad stuff. So don't do that. Be smart. Invest in yourself for the future. Look, Achilles tendonitis. So again, it's this, running will result in getting tight calves. I mean, it's just inevitable. If you're not stretching them regularly, and you probably aren't stretching them well enough, there are 3 different types of stretches you need to be doing to lower the risk of plantar fasciitis and Achilles tendonitis. And if you don't know what those are, and you're not doing them well enough, and you don't know what your range of motion is, well, you're at risk for developing problems, inflammation, and, literally, this could make the difference between you placing or not placing in a marathon. So, knowing your body, if you're investing all this time in running, you really need to take a step back and understand how your machine allows you to run and run better. So we're going to help you run better than you were before you met us. Shin splints, yeah. So kind of the same thing. Foot not stretching enough, etc. Let's see what they say. Common symptoms: dull pain in the inner part of the shin splints. Go away with adequate rest. To prevent them from happening, make sure you strengthen your lower legs and feet, and be careful to increase your mileage gradually. Okay, yeah, so kind of what I was saying before, but also making sure that your dorsiflexion is such that you're not stressing the tibia and that impact, that normal force from the ground. So when your foot hits, the earth pushes back at you, and you can get some little micro fractures in there, and it can be very painful. All right, runner's knee. We left this one for last because it's arguably the most common issue faced by runners. In fact, some studies suggest that 50% of all running injuries happen in the knees. Runner's knees, the patellofemoral pain syndrome, generally refer to pain felt in the front of your knee and around your kneecap. Symptoms of the runner's knee often include dull pain in one or both knees that range from mild to very painful. And I would agree. I've met people with professional athletes that could barely walk into my clinic. And, and a lot of this is, well, let's see what they say. Weakness in your hips and muscles around your knee can put you at greater risk for runner's knee. So strengthening those areas can help you get rid of those injuries and prevent this in the future. Hey, look at that. They're forward thinking and progressive, just like me. Since knee pain can be caused by a variety of factors, you should see a physiotherapist or a sports doctor to have that diagnosed and rule out the other possible conditions. How about even better? How about you making it a wellness evaluation with Atlas Health and Wellness to better understand your body before you ever have any pain? That would make more sense. And unfortunately, the way our insurance system is and the medical system is they don't fix things until they're broken. Now, aside from preventative care, like getting your annual physical and your blood work done every year, the medical system is very, they make more money fixing problems than they do preventing them. And that is why I don't accept insurance, because I got sick and tired of watching people just break themselves and me have to just put them together. I don't want Humpty Dumpty to fall off the wall. I want to make Humpty Dumpty invincible. I want him to break the ground. I don't want him to break. Okay. So anyway, my name is Dr. David Hartwig. I'm somewhat of a lunatic and very passionate about what I do. And I would love to share that passion with you and empower you so that you can keep running well into your older years. Running is not something that you should give up on. It's just something that you need to train your body for. And if you don't know how to do that and you want to learn, reach out to us at info@atlashealthandwellness.com or call us and schedule your free wellness evaluation and start your journey today. Our phone number is 954-932-8527. Talk to you soon.